So we just need to get your consent signed.
Yes.
You've had one of these procedures before.
Yes, yes. Yeah.
But we'll just run through it again. Just remind me what your symptoms are at the moment, please.
It's not being able to walk far, getting out of breath, getting angina, walking upstairs even.
And what does the angina actually feel like to you?
Ache right across my chest and out of breath.
Okay. And that's stopping you doing things you want to
Oh
do?
yes, I can't walk 100 yards, if that sort of thing.
Right, so what we're doing today, as you know, is what we call a chronic occlusion.
Yeah.
So the vessel's completely blocked, not
Yes.
narrowed.
Yes,
And we're unblocking the artery by passing two tubes, one on the top of your arm
yes.
and one on the top of your leg.
Yeah,
And then we thread the tubes up to your heart, take a picture of the left coronary artery and the right coronary artery.
Yeah.
Your right coronary artery is the artery that's blocked.
Yes.
So we'll be passing a wire, most likely in the reverse direction, through your left coronary artery,
yeah,
through some vessels that we call collateral vessels,
yes,
and passing the wire in the reverse direction up the right coronary artery
yes,
to the blockage site, and trying to cross the blockage site in the reverse direction, but actually also passing a wire and a balloon from the conventional direction down the right coronary artery and meeting in the middle, so joining the dots
yes,
effectively.
yes, yes,
Inflating the balloon and trying to then pass the wire back out in the reverse direction,
yes.
so that we can finally then pass some stents.
Yes.
So the stents are the little metal tubes that we
Yes.
scaffold the artery
Yeah.
open with. So you've had a stent
Yes,
before,
before
you
I
have
have,
an
yes.
artery, and we've talked about it. So the risks to you of the procedure are broadly the same
Yes.
as a conventional
Yeah.
angioplasty,
Yeah.
but there are some specific risks that we inform you about. So
Yeah.
because we're going down these little small channels,
Yeah.
there's a slightly higher chance that a vessel could perforate,
Yes.
and there's a very small chance of needing what we call a drain if you were to develop blood or accumulate blood around the outside
Yes.
of the heart. So that's an emergency procedure. It's a small risk, but it's not a 0% risk. It's probably 1 or 2%.
Yes.
In your particular case, if we're going through the collaterals that we're planning to use, that
Yeah.
risk is actually very low.
Yes.
It would be if we used collateral vessels on the outside of the heart.
Yeah.
So broadly speaking, we've got a 1 or 2% chance of making things worse, meaning causing a heart attack. The overall success rate of the procedure is probably in the region of 80-90% success
Yes.
rate. It's not like a conventional angioplasty where we'd be saying 96,
Yeah.
97% success rate.
So it's not far off then.
It's not far off, but it's not an absolute
Okay,
guarantee.
yeah.
So the risk of needing something like a bypass is still a small risk,
Mm.
we say is 1 in 200. We talk about a death risk, it's a very small risk,
Mm.
1 in 400. Rarely kidney function can deteriorate and strokes be precipitated. We do our level best to minimise the amount of contrast we give you, which has an effect
Yeah.
on your kidneys, and that's because this procedure is longer.
Yes.
Similarly, your X-ray dose can be higher, as I mentioned to you.
Yes. I mentioned this before. Yeah.
And again, we try and minimise the X-ray dose by reducing the
Yeah.
magnification field that we'll use. So most likely we'll put in what's called a drug-eluting stent, so you don't have any bleeding problems or stomach ulcers,
All right.
not been anemic at all in the past,
No, no,
and you're
no.
not expecting any surgery in the near future.
No. No.
So we have the choice to use those stents. No reason that you couldn't have a blood transfusion in an emergency.
No.
Okay, so I signed it there to say I'm doing the procedure, I'm the consultant, Dr. Blacksall. I need you to sign here to say you have to go ahead. We do sometimes use your pictures for teaching purposes, we're not taking tissue away. So if you're happy,
Yes. I will
any
do.
questions you want to ask
No,
me?
I just hope we can sort it out this time. Yeah.
So I need you to sign there.
You've had a couple of scans before today's
Yes.
MRI study. And what was that other scan? What did it involve?
It involved arriving at the hospital with nothing to eat and drink, especially coffee. Having an injection, to bring a sandwich and have something to eat. Then you wait an hour, I think. Then you go into the procedure, which is you're laid on a bed and the machine goes round you at a slow pace for about 20 minutes, half an hour, I think. That's not too bad because you're in an open space. And you just I don't know how many people can keep still for a long time. And you've got to try to keep still for 40 minutes or half an hour, 40 minutes. So that's the hardest thing about it. You know what I mean? So you can see all around you, sort of thing. Yes.
Okay, and how did you feel about the scan today? The
well,
scan.
I thought I'd give it a go because they asked me when they phoned me up saying, "Are you claustrophobic?" And I didn't think I was. But it's not so much the being in a tight space around my face. It's with them being a wide chap. My arms sort of crushed inwards, and I couldn't breathe. And it was just feeling as I couldn't breathe, and then I got a panic, and so they took me out. I explained all this to them, and it was absolutely awful. But then I tried again. He said, "Put one arm down here," and then I felt, well, it was horrible.
It was horrible.
And that's so, but it's not that you're gonna have to have that feeling for an hour. And that's not so much the crushed up. It's having the feeling for an hour and not being able to move like that, and you're thinking you're going to stop breathing.
Gosh, okay, fine.
No,
Okay, thank you for talking to
that's
us
quite
about
all right.
it. So what we're going to do now is we're going to get you back to the cath lab,
Yes.
and we'll start the procedure.
Right. No problem at all. Thank you very much.
Thank you.